Hi, my name is Brianne Wright, and I'm a nursing major here at USC. Today, I'm going to inform you about the proper way to care for a soft tissue sports injury because when participating in any physical activity, it is important to know the ways in which you can best recover in case you become injured. Have you ever been injured while playing a sport or even while just doing a physical activity? If you have, you may have wondered how best to recover from a soft tissue injury such as a sprained ankle. A quick search on the internet may have led you to use a method called RICE, and in this speech, I will tell you more about this method and how to use it. I'm a former exercise science major with experience as a physical therapy technician, and I have studied many types of sports injuries within the last 3 years. Injury rehabilitation is an important science to me, and I enjoy telling others about the things I have learned. In this speech, I want to inform you about a recovery method that has been used for many years called the RICE method. Knowing how to apply the RICE method is significant for college students in particular because we are at a time in our lives when physical activity is common and sports are a large part of many college-age students' lives. Understanding how to recover from an injury quickly and easily is the first thing on an athlete's mind after they are hurt. RICE stands for Rest, Ice, Compression, and Elevation and is an easy method to teach people on how to best recover from many soft tissue injuries, which are injuries to muscles, tendons, and ligaments, but excluding bone. In this speech, I will go over each step of RICE to best inform you on how to apply and use this method of recovery. To begin, I want to tell you a little bit about the significance and prevalence of soft tissue injuries and the help RICE can provide to people who experience these types of injuries. Soft tissue injuries, such as ankle sprains, are one of the most common athletic injuries and are also very easy to treat. A sprain is a condition in which a ligament is overstretched and can cause instability. When tendons or muscles are overstretched, it is called a strain. Around 50% of soft tissue injuries are sports related, with some sports having more injury prevalence than others. This high percentage of prevalence makes having a method of recovery very important. The RICE method is used to treat these injuries in an effective and affordable way. The subsequent use of rest, ice, compression, and elevation after an injury can help control inflammation, pain, edema, heat, and other problems that can cause patients to have inhibited healing and discomfort. An important thing to remember before using the RICE method is that every injury is different among different people, so recovery should be tailored to the individual person rather than just used as a one-size-fits-all. Rest is important in protecting the injury. Icing the injury is important in reducing inflammation and pain. Compression helps to decrease swelling. And lastly, elevation helps to minimize the swelling. The first step I'm going to talk about in the method is rest. After an injury, many people wrongly assume to walk it off or to not baby the injury. While this may be helpful in small amounts, the RICE method suggests resting the injured area first. The reason for resting an injury is to protect it from further damage. Resting the injury can range from not moving the injured area to having to use crutches or a sling daily. Continuing to use the injured part can cause it to have increased pain as well. As soon as possible after the injury occurs, you should stop the activity that caused the injury and prevent going back to it for at least 48 hours. Keeping a happy medium of no less but no more than 48 hours of rest is important in preventing further injury. Although, if you rest for too long, you can cause stiffness or poor circulation to the area. Decreased circulation means decreased healing, and the amount of rest should be tailored to meet the individual person's needs. An example of this would be to rest for a few days and then gradually add in work, but only with absence of pain. After resting the injury, you need to apply ice. One of the main areas of concern after an injury is inflammation. Icing the area can decrease inflammation in the area and induce healing. Inflammation can cause increased tissue damage and delayed healing to the area of injury. Because of this concern, the RICE method is preferred for the first 4 to 5 days after the injury to control swelling and pain. The use of ice is most effective within 24 hours after the injury occurs. To ice, wrap something frozen, such as an ice bag or a bag of vegetables, in a damp towel and place it on top of the area for 15 to 20 minutes, rotating every 2 hours. Never place ice on bare skin, as this can cause damage and pain to the skin. If after 48 hours the swelling has minimized, you can apply heat to the area as needed to help with the pain. After you ice the area, find a way to apply compression. An often overlooked step in recovery happens to be compression. Compression is used to stop hemorrhaging of the area and to minimize swelling. Swelling occurs from the fluid exudate coming out of the tiny damaged capillaries in the tissue. To limit swelling after the injury, it is suggested to wrap the area with ACE bandage or a compression sleeve. Compression sleeves and ACE bandages can be bought at most drugstores or grocery marts. Before wrapping the area, be sure to choose a bandage that can cover the whole affected joint. Make sure the bandage is not too tight on the joint by checking for things like numbness, pain, tingling, swelling, and cool skin. All of these are signs of restricted blood flow, and the bandage should be loosened immediately. After compression comes the last step, elevation. Elevation is an important step in the process because it helps to redistribute the blood from the injured area. Elevation is used to lower pressures in the blood vessels around the injury, which limits bleeding. Limiting bleeding can help to decrease swelling by causing the exudate from the injury to be drained into the lymph vessels. It is suggested to elevate the injury for up to 3 hours a day until pain begins to lessen, but this number can vary for different people. To elevate, place pillows or cushions under the injured area to keep it raised. You can also elevate while applying the ice, so to further increase healing. While elevating, try to keep the injury above the level of your heart. Another method to help healing while elevating is to take an NSAID. These are non-steroidal anti-inflammatory drugs. NSAIDs that can help with soft tissue injury pains include ibuprofen and naproxen, which is found in Aleve. As you can see from the points above, the RICE method is easy to use and an effective way to have successful healing. Soft tissue injuries are very common, and they can also be extremely painful. After using the RICE method and your pain lessens, try to start stretching the area and gradually add in some exercises to get back to normal. If after using the RICE method you are still experiencing pain, you may have a more serious injury. If this occurs, consider seeing a medical professional, such as a sports medicine physician, to see if there are any other ways to combat your injury. RICE stands for Rest, Ice, Compression, and Elevation, and is an easy method to teach people on how to best recover from many soft tissue injuries. So, the next time you experience a soft tissue injury, such as a sprain or strain, try out the RICE method and experience a quick recovery.